Research has found 9% of the U.S. population will be affected by an eating disorder in their lifetime. Many states are considering legislation to address this, with some focusing on regulation of social media.
My eating disorder started in March 2020. Amidst the pandemic, all the chaos of the world, I just started counting calories. Being on social media, it's pretty affluent. You see diet culture posts promoting weight loss. So I went along with what everyone else was doing and just started off slowly, like increasing my exercise, decreasing what I was eating.
In January of 2021, Emma Werford says she was diagnosed with anorexia. She considers herself a successful student on track to go to UCLA in the fall for political science and pre-law. But she says isolation and stress during the pandemic was too hard to handle.
I started using calories as a way of dealing with all the stress. It was my main coping mechanism because I really didn't have any coping mechanisms.
Eventually, she was admitted to the hospital. But Emma wasn't alone in her experience. The National Eating Disorders Association says when the pandemic started, emergency room admissions among adolescent girls doubled.
We've seen people who were previously engaging in disordered eating really started struggling with a full-blown eating disorder, or we started hearing from people who were in recovery to relapse during the pandemic.
Now, legislators across the country are taking action.
Some states are working more on the spectrum of improving access to care around eating disorders. Other states are working on improving medical standards.
Amanda Raful has been pushing to ban the sale of weight loss pills to minors. She is part of an advocacy partnership between Harvard and Boston Children's Hospital. She says there's been legislation movement related to eating disorders in states like California, Colorado, Texas, Kentucky, New York, Massachusetts, and Maryland.
There was also a pretty big push last year federally to try and pass a bill through Congress that would similarly put in protections for youth and online spaces. As it relates to eating disorders, there's a growing body of evidence that shows that certain types of social media use can increase the risk of developing disordered eating behaviors, especially for young people.
Emma says social media influenced her battle with anorexia in both good and bad ways.
I've been able to find a good recovery community to support me throughout my journey, but at the same time, I've also seen the parts that are degrading and contribute to mental illness, parts that are encouraging diet culture and even parts that encourage eating disorders.
Someone who maybe is predisposed to an eating disorder, they see this, and this might be the thing that pulls the trigger, right? So with eating disorders, genetics and temperament and family life kind of load that gun, and things like social media and society pull the trigger.
Emily Hemmendinger at the University of Colorado Anschutz Medical Campus has studied how social media can impact eating disorders. She says algorithms are particularly concerning because if somebody watches one video related to an eating disorder, platform algorithms will feed you more and more of those videos. Amanda says it's those algorithms that legislators are hoping to change.
Because social media platforms don't have any sort of legal obligation to release data or details for researchers like myself or for public health advocates and policymakers, one of the things that our legal team has highlighted as a potential avenue is conducting assessments or audits of what algorithms end up showing to vulnerable youth.
In the meantime, medical professionals, social workers, and people like Emma want other teens to know that recovery from an eating disorder is possible. Awareness, education, support groups, and access to care is what Emma says led her to where she is today.
Physically, I feel obviously energized. My grades have improved a ton through my recovery just because I actually have better cognition, and my brain has more energy to work. And just like in general, I didn't think I'd be as happy as I am in recovery, but in reality, I'm so much better than my life was before.
Elizabeth Ruiz, Scripps News, Denver.